than that of broken down India. I mentioned last night that we're swamped daily with reported cases, 350,000 daily infections representing a quote-unquote crisis. But even in India, over 99% of these are mild. I mentioned last night we have changed the definition of pandemic, which now seems to relate not to deaths, but to cases. India admits that since this virus began 14 months ago, there have been 198,000 deaths, with a population of 1.3 billion. That is 0.15% of the Indian population. On average, 471 a day. But as I said last night, 27,000 people die in India from all causes every day. 27,000. If, as is reported, 2,800 people died in one day, that's 10% of all the people who die in India on any one day. I note today, to add to the alarmism, we're told that 117 Indians are dying every hour. This is just a more hysterical version of the 2,800 who died in one day. Do the maths. 117 multiplied by 24, same figure. Different, but more dramatically presented. As I said last night, and I say it again, I'm trying to dismantle this alarmism. If we accept 198,000 deaths in 14 months, and if we accept that 27,000 people die in India from all causes every day, then the coronavirus deaths over 14 months equal 7 days of death. On this program, I'll stick to facts, not fear. Let me tell you something else you won't be told. In a 2020 report on healthcare around the world, Global Climate Risk, based on 153 countries, India ranks 112, 4 places down from the previous year and well behind in healthcare countries like China, Nepal, Sri Lanka and Bangladesh. The Indian healthcare system is a mess, and no amount of headlines or rhetoric or alarmism will repair it. There is widespread unhappiness in India with the system, a lack of accountability, unethical care, poor cooperation between public and private spheres, barriers of access to services and medicines, and a public health system poorly funded. 75% of healthcare expenditure in India comes from the pockets of households, private healthcare. But the price of this private healthcare in India is astronomical, and the cost of it is one of the causes of impoverishment. And because there's a lack of regulation in the private healthcare sector, there are widespread variations in quality and cost. As I've said, the public healthcare system in India is a mess. Forget coronavirus, 12% of all maternal deaths and 18% of all infant mortality in the world occur in India. 36 out of 1,000 children are dead by the time they reach the age of 5. Communicable disease is the cause of death for 53% of all deaths in India, long before coronavirus. India has one of the lowest public health care budgets in the world, 1.26% of GDP. Ours is almost 10%, America's 16%. I hope that political figures here are not using this alarmism over India as a political weapon to tell Australians that we should be grateful for our wonderful politicians because we don't have India's problems. I've said from day one, this whole coronavirus story has seen fear dominate fact.